terms of dentistry, in terms of all things now, you can just see what happens with coronavirus. What happens is there's just no option to do that anymore. And the problem is, if you have a problem, you know, and I get patients come in, and you ask my staff, I get them from Thailand, from India, from Vietnam, I get them from all over the world that come in, where people have gone and they've sought treatment that's cheaper. And then what's happened, it's backfired on them because they've got a problem. So and the next question is, why did the teeth break down without maintenance? It's not the teeth that break down, it's the implant. So what you can do is you can get a thing called peri-implantitis. Peri-implantitis is basically irritation or infection around the implant because the implant is not being cleaned properly. So that's really important. So the 27,000, and someone asked, is that the full set of teeth or half? 27,000 is per jaw. So if you've got one jaw, it's $27,000. If you do two jaws, it's $54,000. I hope that clarifies that. Another question is saying that unless I have dentures, I can't have all-on-4. No, I'm not saying that at all. If you have all of your own teeth and your own teeth are completely loose and you've got severe gum disease, then all-on-4 is wonderful, because sometimes what happens is people go and have their teeth out and they wait 3 months and have a denture, then they come back in and then they have their implants placed, wait another 3 months and then make their teeth. If you have your own teeth and they're failing, it's better to keep those teeth, have them out at the operation, and at the operation, we remove the teeth, we remove the infected bone, because around the gum disease teeth, there's infected bone. We get back to very healthy bone, and then we can put the first set of teeth in over on those implants within 24 hours. Okay, so again, I reiterate, it's 27,000 per jaw. So another question, I have gum disease, they are falling out periodically. I have gum treatments, though they are falling out. What can I do? I think what happens is you get to a periodontist, and the periodontist will give you a decision of how long are those teeth actually going to last in your head. And then you get to a point that you make a rational decision. Do I keep going down the path of spending more and more money on the periodontist and continue to lose a little bit of bone? Or do I make a decision to be a little bit proactive? And that means take the teeth out. I'm not saying maybe a little bit ahead of where the periodontist thinks they could come out, and do the all-on-4, because when you actually take out the teeth, level the bone and put the implants in, then you don't lose the bone. The bone holds itself. Okay, so really what that is the bone will bond around the implant, osseointegrate, and once that's done, everything is static. The only reason then it will break down is if you don't look after it, or you get infection, or you happen to be in that 2 or 3% where we don't know why, but an implant could fail for no reason. It's very small when you think about it. It could be 3 out of 100 implants, but it could be for no reason that we understand. I've had people lose implants, and then we've come back, and a couple of years later, they've come in and they've had an autoimmune disease, or they've got sick with cancer, and they've got other things, that other medical things that have happened to them later on. So that can be a little bit of an issue in terms of that. Another question, can you describe the 3 months after removal of teeth and before the teeth are done in terms of eating? Good question. So the question is what we're going to do is we're going to actually take the teeth out, put the implants in, and deliver the teeth on day 1. You're then on a modified diet for the first 3 months. That means you're not eating a hard apple, you're not eating a hard steak, you're minimizing the pressure on the teeth. You're going to have fish, you're going to have pasta. In fact, the girls will give you a recipe guide of what you can do. that from that point of view, you just have a softer diet. And that's important to adhere to that, to allow the bone to grow onto the implant. You don't have to starve, but a lot of people actually say they lose a bit of weight actually in that period, and people aren't happy with that. Another question that's come up, is there a delay on this because of COVID? Yes, certainly there is. In Melbourne, we are in lockdown. So, you know, we can see people that are in pain. So if you've got pain, the government says we can see you. So we might not do your all-on-4, but we can certainly, if you're in pain, manage your pain. We can certainly look at what's causing the pain and do some planning so you can get a little bit ahead. But we can't just do everything. We have to adhere to what the government says. That's very important. I understand what all-on-4 is. I can have recent x-rays sent to you. I don't want to waste money on dentures, etc. As it is inevitable that I need more help. Please contact me for a realistic treatment plan. Well, that's someone's name that come through. And then we can obviously, you know, anybody on the list today, we can send something to or send a note to us, and we're very happy to get back to you. An anonymous attendee, what are a zygoma implant? A zygoma implant is the implant that was designed for the upper jaw for the patient that has no bone left in the upper jaw. It means the bone either melted away, and it melted away because of gum disease, or it melted away because you'd had dentures there for many, many, many years. In that case, we do the zygoma implant where the anchorage is into the cheekbone, and that's done by the oral and maxillofacial surgeon, not a general dentist. So those zygoma implants have been around for many, many, many years. Designed by Noble Biocare, the implant company. Of course, other people come in, but Professor Malo just recently redesigned it. He redesigned it. In fact, it's important to understand this, and I didn't mention it in the lecture, is that not only did the implant, the speedy implant, which was written down, is manufactured, we've manufactured more implants. The speedy implant starts in 7 millimeters of length and goes to 25 millimeters in length. There's a narrow implant, there's a regular implant, and we even have an implant for very soft bone that no one else has. It's called a Speedy X implant. It's an implant designed, it's a 5 millimeter implant, and all the other companies that come out and say, oh, we can do all-on-4, it's like going to a gunfight with a knife. It's never going to be a good outcome. The beauty about the Malo protocol is we have all the implants that are designed, a 7, 8.5, 10, 11.5, 13, 15, 18, 20, 22, 25. And then we have them in narrow and we have them in wide. So we have a solution for you. And the implants were designed for this procedure. So make sure you get the right implant, very important. So another question, which is a great question. I grind my teeth and wear a mouth guard to bed. Will I need you to continue that, and is that okay? That is a really good question. If you grind your teeth, you wore away your own teeth. You will then wear away the all-on-4 teeth. So absolutely you'll need to wear a mouth guard, and you'll need to be religious about it in terms of what you do. The other thing that we can do, which is coming more and more important, is because a lot of people can't stop the grinding. So actually what we do is into the masseter muscles, which are these muscles here and these muscles here, we have our doctor on staff can actually give you some Botox. It's not to make you look young and healthy and wrinkle-free. I haven't had the Botox, but you can actually put it because it enables us to take the pressure out of the implants. So you can, if you grind, you can't put the same amount of pressure on. So you may need Botox, and you may need a course of Botox. Some people that are habitual grinders may need it over a whole period of time. So yes, you definitely need the mouth guard, and you may need the Botox as well. Is there an age limit? I'm 81. Well, I've done a 95-year-old. There is no limit. Age is not a limit. The limit is health. So if you're a fit 80, 90-year-old, you can have the procedure tomorrow. If you're an unhealthy 40, 50, 60-year-old, then we have to look at your medical history, not because of the putting the implants in, but because of getting you through the procedure very, very safely. All right. So it's very, very, very important that you do that. So does everybody understand? Age is not a limit. Medical is a limit. Can I still have an MRI? Yes, you can have an MRI without a problem, and because the metals are not enough to interfere with that. Here's a good one. Can I still train at the gym? Well, yes, you can. I'd still take a week off the gym. If you're pushing heavy weights and you're gritting your teeth together, I wouldn't suggest that. You know, I always say, give yourself a few days recovery after a general anaesthetic, if that's the way you're going to go. But certainly, yes, after a week, you can get back in the gym. I don't see any problems with all that. I wouldn't suggest getting back into the swimming pool, because sometimes you can't get into swimming pools. They've got bacteria in them, and it goes into your nose, it goes into your mouth. So perhaps I'd stay away from swimming pools. But at the moment, you know, we're not allowed to do anything anyway. We're locked in at home, so we can't do anything. So a question, what are the health benefits, the item numbers? Well, look, I think if you've got all these questions, when you call the surgery, you're going to ask for my coordinator, Rochelle. She's the absolute expert on all these things. She's got a lovely English accent, so you might have to ask her a couple of times what she said. But she will tell you, give you all the item numbers. She will talk you through the whole procedure. She is your concierge. So when you arrive, from the day you arrive to the day you finish, she is going to be your concierge, and she is going to look after you, and she is going to make sure you get through this journey very happily. And it was a positive and a good experience for you, because good experiences is what we have, and people just keep coming because of that. I smoke. How long should I give up before I go on this journey? Well, you know, some people, I always say, if you stop smoking for a day or two before, 2-3 days, that's really good if you're having a general anaesthetic. So you don't actually have to stop the smoking for a month or 2 months or 3 months before. What we asked is that you stop smoking once we've done the procedure. So don't smoke before we're going to put you to sleep. We don't want smoke going over stitches, raw tissues. We want to give them a chance to heal. So you can 2 or 3 days go cold turkey. Some people go for patches. Some people, you can go to your doctor. There's all sorts of things. I've even had people go through hypnotherapy. So there's a lot of things you can do. But you basically need to stop your smoking just a couple of days before the procedure, and then after the procedure, then we hope you stop. So the anaesthetist, is that an extra expense, I'm asked? Yes, it is. The anaesthetist is an independent person. Obviously, he's in charge of your health, your life. He has a fee, and Rochelle can discuss all those things with you. Is it still considered all on 4 if you need more or less than 4 implants? Well, that's an interesting thing, because all on 4 is 4 implants. Sometimes we put in 5 implants if you're a heavy grinder, and sometimes we might put in 6 implants. But sometimes there's not enough room to put in those, because if you look at the anatomy of the jaw, and you think, I'd like to put in 6, but where you'd put in 6, you need to put them at the back of the jaw, and then you run into problems. I don't know, I've got a whiteboard here, if you can actually see, if I draw something very large, and you see, here's your nose, here's your sinuses here, these are your air spaces, this is your sinus here, and the distance here sometimes is really short, and you haven't got enough room to put the implant in. And the all-on-4 implant runs on the angle like this to avoid the sinus, because this is air. So when you put 1 implant here and 1 implant here, 1 here and 1 here, if you try to get another one here or another one here, it's too crowded. So you don't want too many implants in there. If you have 6, normally what you do is you put an implant back here, but that's in air. You can't do that. So therefore, you'll need to have bone grafting and do the other procedure that's not all on 4. Now, if you're keeping some of your teeth and you're just having implants in between them, then that's certainly just having normal implants, and I wouldn't really consider that as all on 4. So I hope that